Hey everyone, it's Tim Nowak, your Assistant Chief of Special Operations. I wanted to give you a little bit of insight into what's been going on with the Special Operations section so far, and then also a little bit of an idea of what my vision is for this section going forward. So to date, as you're aware that this position was developed as kind of a bridge, in my mind at least, a bridge between operations and the administrative section, taking a lot of the duties and responsibilities that were on the plates or are currently on the plate of Chief Jones and Chief Liu, and even some of those that are on the plate of Chief Crutchfield, and blending them into this combined or collaborative position. So again, my name Tim Nowak. I've been here with the organization since March. I've been around and at least had a chance to meet or bump into a fair share of all of you. But having said that, I'm still doing rounds, still getting oriented, and still trying to get around to meet all the many faces within our organization. So this again is a new section within our department or within our division, and it's focusing on special operations, support services, and community paramedicine. So as far as the design, what was this position built for? What was this section built for? So as far as the current structure, this whole section oversees special operations and the multiple teams that are involved with it. The support services area, so essentially our logistics branch, still overseen by a manager and the support staff, and then the community paramedicine program that we have, with the district chief, community paramedics, as well as the alternates, social worker resource coordinator, our LECOM pharmacy interns in the program association that we have there, and then also the multiple volunteers and then stakeholder partners that we have on the back end. Now, as far as special operations, a lot of this or a lot of the responsibilities currently are being shared by the operations and the administrative section. This includes things like the special operations team, SWAT medic program, again, that's still a partnership with MSO, the deployment opportunities that we have, the SABRE, and then also other special event staffing opportunities, the Raptor program that we've got with the bus or the AMBU bus, and then the fire medic program. So again, these are all multiple programs that are being shared by two different sections within our organization. We also have the support services area, or essentially our logistics branch, which is overseen by Mike Kelly, the manager there, and then this is overseen overall under the administrative section. Now, this area is a huge area in itself, and really would be, more suffice to have a presentation of its own. In quick for this presentation, or at least in briefing, I'm just going to give you some quick details on it. This organization, this section, is part of our $21 million budget. It's a huge part of the organization. Aside from, employee expenses, salaries, benefits, wages, the logistics portion of it usually makes up the remaining brunt of any big budget. So everything from durable supplies, disposable supplies, apparatus buildings. Again, we do a lot of our ordering through Operative IQ, and that's our primary software. And then collaborating with other partners within the county, so fleet services, the radio division. So really, in a sense, if it's purchased for your use, it likely came from support services. So again, I'm going to go through this very quickly as far as the relationship and the oversight with respect to support services, but knowing that this, is a huge section in itself. And we have our community paramedicine program. So a lot of the responsibilities here are currently shared by the special operations section currently, and then also others within the leadership team. Chief Crutchfield, DC Dwyer have a large role still in this portion of the organization, and then as well as District Chief Zach Molnar, recently promoted upward. So our focus here is to focus on those high intensity users, the high risk populations that we see within the public. So going forward, what's the vision? What's the goal? What's the plan? At least from my perspective and my observation, having been with the organization over 3 months. Now, as a quick disclaimer, this is my vision. This is not set in stone. There's a lot more that needs to be accounted for and built up in order for this vision to become a reality. So having said that, I need your support. I need your input. I need your perspectives, your insight, and I want to collaborate with all of you to help build this section into a success story. So as we know things now, or at least going into the future, Manatee County EMS, the Special Operations section, here's a little bit of a breakdown of what I'm envisioning. Now, as far as the special functions, when I organize things, when I set up my day, when I try to allocate where responsibilities go, or what the vision for the future looks like, I divide things into, I guess, three separate areas: emergency preparedness and response, community risk reduction, and then logistics. And we'll break down each one of these things. Starting with the emergency preparedness and response, a lot of this area I think is going to be seen, or at least in the front end of it. So all of you working in the field will know this through the special operations team, and we'll discuss this coming up pretty soon. Other areas or other aspects that I see throughout this portion would be related to deployment and then special event operations. So utilizing the Raptor, whether that's for special ops team purposes or task force strike teams, rehab, rehabilitation, or other mass casualty responses, different special event planning areas respective to the SABRE or even the MAD or UTV operations, and then other programs like SWAT and Fire Medic. So this is all part of what I envision is that deployment and special event operations portion. Other areas here too are related to our preparedness aspect and some of the operations related to pre-planning, the incident action plans or after action reviews, ESF 8 functions, the medical and healthcare branch of things when you get into the higher level of emergency operations center activations. So those are all functions within this area that I will likely have a very large hand and role in. Now, bridging into the concept of community risk reduction, or CRR, this is an interesting concept where our colleagues in the fire service, for those that are in tune with that industry, have transitioned a lot of their terminology away from fire prevention and toward community risk reduction. And really, in a sense, I see a lot of what we do, especially through community paramedicine, as this same adaptation. So within the community paramedicine program, some of the things that I want to emphasize here is what I consider an own concept, focusing on outreach, wellness, and the navigation, identifying target populations that we can help, getting them the resources that they need, getting them or at least identifying what can help them along the way, and then navigating them through the system appropriately. Do we need to transport these patients, or do we transport them to an alternative destination in the future? Do we care for these patients at home? So these are all areas within community paramedicine that are being explored. Some of the ways that we can do this, especially in the very near future, are actually through telehealth and then through remote medical devices. So these are two extra components that we're going to be seeing more within our organization in the very near future. Now, also I see public information and outreach as a big part of this too. So working not only with our community client and patient-focused partners, but also our workforce too. So injury prevention on more of that community and then client and patient side of it. But with the workforce, I foresee, or at least envision, some possibilities within the marketing perspective and recruitment side of it. Trying to get people to come to our organization and then stay here, of course, and trying to inform the public about what we do. So that I see as part of that community risk reduction whole total or holistic concept. And then also lastly here would be our partnerships and collaboration with a number of different resources. So hospitals, community resources, the government entities that we partner with, the shelters, you name it, everyone in the community that we interact with from the organization standpoint. I foresee some collaboration or partnership or relationship through community risk reduction. So this again is kind of a holistic approach to what I envision, not only with community paramedicine, but even beyond that. Now, with respect to logistics or support services as we know it, this currently is aligned under the administrative section. It's anticipated, however, that on October 1st, there's going to be a full transition over toward the special operations section. So within that time period, and then afterwards, what I'm going to be focusing a lot of attention on are items like consistency, improved workflow, and then waste reduction. So through utilizing our operative IQ tracking process, our vending machine restocking, and then other best practices within the organization, everything from radio updates, coordinating your fleet needs, ambulance purchasing, station capital planning, disposable and durable items, and then those that we asset within there, so those that have a higher price tag. All these items are associated with the logistics side of the house. So really, in a sense, our agency operates because of you. but our agency can operate because of logistics. So a huge area that deserves a lot of respect and accountability and a lot of attention. And as such, I want to make sure that this is a solid area, a solid foundation that we can rely on moving forward. So over the past couple of months since my arrival here, I've been assigned some special projects to work on, one of which is CAS Accreditation. So if you're not familiar, this is the Commission on Accreditation of Ambulance Services. It's a very, I guess prestigious would be an appropriate word, prestigious accreditation recognizing high caliber EMS organizations. So this is something that on the back end I'm gathering data on, gathering information. It's very policy focused, practice focused, and focusing on the efficiencies within an organization and the transparency and communications too. So this is a huge project that we are working toward, and I've got a pretty big hand in this. From the bag and equipment work group standpoint, this is a work group that we formed looking at the current way that we carry stuff as far as med bags, trauma bags, BLS, ALS bags, and looking at, do we need to get new bags? Do we need to change the system a little bit? So these are all items that we are addressing, and hopefully to get you some results in the upcoming months. With GO reviews, this is in partnership with the rest of the administrative and leadership team, making sure that we have up-to-date policies and procedures, and these are being communicated and rolled into the Power DMS software that Chief Crutchfield has talked about. All right, so the long-awaited or anticipated discussion point, looking at the Special Operations team in more detail. So with respect to the Special Operations team, really what I'm looking, or at least envisioning and building, is a team or a unit that is broken into 3 different task force functions. And we'll discuss these coming up. But ideally, I'd like to utilize this team as a primary or initial resource for deployment, for rehab, special rescue operations, and do this also in collaboration with our local fire department special teams, things like USAR with hazmat. So building this program, again, needing your support, I would really encourage all of you to take part, to apply, to join, to help build this program. And so moving forward, we'll talk about what that all entails. Now again, part of the goal here and part of my vision, nothing is written in stone quite yet, but part of my vision with this entire team is to work collectively with all of you to build an education and training focused team that has both general and specialty knowledge in a number of special operations disciplines. And those are the MASS, HAS-BIO, and then DMR disciplines that were mentioned previously, and we'll get into each of those, breaking them down in a little bit. So what I'm looking at here, or at least thinking about, is somewhat of an application process. And this would be something that would be open to all provider levels, having some general education requirements, and that we would use internal and external resources to put together, develop, and then deploy for all of you. And then also some additional specialty or discipline education respective to those 3 different areas. So what I would envision, at least through this, is that each person that becomes a part of the special operations team would proclaim somewhat of a discipline specialty. And that could be the MASS, the HAS-BIO, or the DMR. And within that area, there are general requirements, but then there's also annual specialty requirements respective to CE and then attendance for training. So in this team, or with this team, hoping to develop quarterly and then outreach training with a lot of our outside partners. So like the fire departments, USAR teams, hazmat, beach patrol, and really anyone else that we can get involved. So as far as those disciplines, one of them being the MASS task force. So this to me means mass casualty, mass gathering, mass evacuation. So emphasis here is going to be placed on the Raptor, the operations familiarization and use of it, and MCI response. Part of this also would be like rehab emphasis. So focusing on, when we've got mass gatherings, multiple people, added specialty training respective to NIMS ICS courses, rescue task force, MCI operations. I want the people who have this specialty to have an interest, a peak knowledge, and preparedness ready to respond to these situations. On the HAS-BIO front, this one to me, hazmat biohazard type emphasis. So working with local hazmat team, collaborating with them to focus on research, on care, toxicology and exposure treatment, pandemic response, screening. So we think about what we have had established through COVID and how we utilize the community paramedics and the squad units. This to me is an opportunity for the future to have specially trained individuals that have a higher level of training, higher level of knowledge and experience within this area that we can frontline face for the next pandemic whenever that hits. So specialty training here is going to be focused on toxicology and exposure responses, radiological, nuclear hazards, biohazards, pandemic, and then other hazmatic topics. And third would be the DMR Task Force. So this is a disaster medical response, somewhat of an emphasis on USAR or urban search and rescue components, and then collaboration, technical rescue responses, disaster responses, and deployment. So a little bit more of a hands-on technical focused. And again, with all these three disciplines, I want to capitalize on the knowledge that all of you have and the knowledge that we can supply you in each of these three disciplines. So specialty training here is going to be focused on that technical aspect, some of the rescue operations, disaster response. So as a part of this team, also what I envision is that general information, that general knowledge that we all should have. Focusing on water rescue, motor vehicle collision safety, extrication tactics, and traffic and incident management. Now, that's not to say that we're going to start throwing, extrication equipment on the ambulances. That's not the point here. Instead, what I want us to have, especially as a specialty team, is focused and added knowledge, focused and added experience and abilities, so that when these situations happen, these are individuals that we can count on to be an added resource, a supplemental resource, and can focus their attention toward this and the patient care aspect respective to these different hazards. So disaster preparedness response, RTF SWAT partnerships, using things like our target training. So these are added areas that I want to focus some general knowledge and education on for the team, and then also for the organization in general. All right, so this is all, again, a vision. And in order to build this vision, to promote this vision, to make all this happen, I need your support. Building a section is no easy task. Building a team, nonetheless, is no easy task. But if we build it together, it can certainly make this much, much easier. And that's what I'm asking for. So again, recapping on all of this, this is an area, this is a section, a specialty that I've got a lot of passion toward. And finding a position like this and then being asked to be a part of a team building this section and building this organization and becoming a part of your organization, I take great pride in that. Coming from another state in a different system, nonetheless, that's a big feat in itself. So it's heartwarming coming to a place that has an open mind toward building a special operations program and team. And I'm excited about that. I'm excited about building this with all of you. I appreciate questions. I appreciate thoughts, discussion, and certainly want to make sure that I'm available to engage in that with you. So don't hesitate to reach out. Email me, shoot me a call. I'll stop over. Let's have coffee. Let's talk about this, and let's build this program, this organization, into something that is strong and is lasting and is collaborative and has great potential and is a reason for all of us to come in on every day and to be proud of. So thank you, everyone. I appreciate your time, and as always, stay safe.